Hello everyone, you are all welcome to lecture number 1191, and today's topic is common causes of vertigo and its treatment and the symptom of vertigo. Nowadays vertigo is divided into three categories. One, it is in male, female, and then in adolescent. And when I am talking of vertigo, it is the spontaneous spinning of your head, your feeling, sensation of spinning, and also the deep sensation of feeling that around you everything is moving. Your surrounding area, your head, you are not balanced, dizziness and weakness, nausea. That is the real symptom of a vertigo. And here, the proper diagnosis is very important because, if I say symptom is the language of any medical condition or disease. It's a language to tell you. Just like if I have pain, I will tell you that I am having pain in knee or in eye or in neck. So in the same way, it is your body language to tell you that what is the problem inside your body, internal problem or external problem. So that symptoms are to be properly diagnosed by a good experienced doctor, that medical condition of vertigo. And this sensation of twisting, or we can say the feeling of disbalance and moving everything around you, is because of first condition, that is called peripheral vertigo. The other condition may be central vertigo, and there are different names. Dizziness, then benign, proximate, positioning, vertigo, like that. But more than 60% vertigo condition is from the problem of your ear, internal ear. If there is any problem, infection or some nerve compression inside ear, because your ear, whatever nerve cells are there, nerve hairs, they are linked to your brain stem cells, and that nerve sensation, if it is not properly passed to your brain cells, you will feel dizziness or sometimes spinning. And it is the air from where the balancing of your bodies are there. And in that condition, sometimes people are confused of brain stroke is wrong. Because in the case of brain stroke, your any portion can be non-functional, that is called paralytic condition. It will be paralyzed. So once you are having such sensation of spinning condition or disbalance, first thing is that you lie down on the bed and take rest, and make sure that your movement of the head is very slow, gentle, left, right, or up and down. And also, if you have the tendency of getting vertigo, that sensation of disbalance, you should always be careful in night. Even when you are going outside, you should go with a stick. And why this condition is very much serious, in the sense that anybody who is having the tendency of vertigo means you cannot walk properly, you are disbalanced, and also always you are feeling dizziness and spinning condition, everything moving, you are not balanced, it drastically affects your quality of life. You cannot go with your loved one outside in market or visiting some places. You are always locked inside the house because you are not sure when this attack may come. And this attack of vertigo may last for few days and maybe for few weeks. It depends upon how you are taking care. So once you have the tendency of vertigo attack, that is spinning and moving of your head, and you are not feeling balanced, severe headache, here your migraine is also involved. That condition means severe headache, nausea, vomiting, all are combined together. So once this condition is there, you have to be very careful in your lifestyle, especially the food. You have to identify what type of foods are triggering factor. So the most triggering factor of the foods are first processed and ultra processed food or junk food. If you are taking regularly this food, it can trigger the condition of vertigo. The reason is that all the processed foods, they are not fresh. They contain lot of chemicals, synthetic chemicals, preservatives, and all the processed foods and drinks, they contain high amount of salt and sugar. So once there is lot of salt, it will trigger. The reason is that once there is salt, it will disturb the fluid balance of your body, because we human being, we are not solid, we are not liquid, but we are in between. Our status is fluid. So whenever there is any disturbance in the fluid, it can trigger the medical condition of vertigo. Means spontaneous dizziness, and also that is spinning condition or twisting of whole area surrounding, like that type of strong feeling. And thirdly, you avoid the acidic food. Once I say acidic food means heavy food like red meat and others. Go for lean meat, means fish. And if you are taking meat, it should be chicken without skin. And also, you avoid the strain. Those who are having the tendency of blood pressure high, some 20 to 30% people, they get because of the high blood pressure. Also, it has many factors, multiple factors are there. Mental tension, stress, losing loved one, and then you are terribly shocked. And in that condition, some of your nerves sometimes are damaged, internal ear and other nerves. And here, you should not have confusion about spondylitis, because some of the doctors, they are also confused of spondylitis. That is the spacing in your vertebral column, 5, 6 or 7. And once there is any problem in compression or some disturbance of nerves, you can also get the dizziness. But here this is quite different. It is because of some damage or some compression of your nerve cells in your internal ear. And because of that reason, you have two problems. One, that is dizziness, and then twisting, or we can say spinning around you, and your feeling. And secondly, your ear is also responsible of balancing. You will be disbalanced. So these are all factors. And also, the good food to reduce the tendency is citrus fruit, and especially the blueberry, gooseberry, that is amla, and then grapes, all the citrus fruits which are rich in vitamin C, vitamin A, and also the food which are rich in vitamin D. because these fruits, they are rich source of antioxidant and anti-inflammatory. So once your inflammation is reduced, is controlled, it will also reduce the chance of triggering of this condition, and also check that you are not dehydrated, because dehydration is the mother of lot of symptoms and problem. So lot of problems is there. Because of dehydration means your body is containing less quantity of water. And best thing to check whether you are dehydrated or not, just take your finger scan. If it stays there by pulling, and if aging is there, it means enough water is not there. If enough water is there, all these will be having good elastic condition. So be hydrated. B means always drink enough water so that the chance of dehydration is not there, because this is also one of the condition of triggering the that is vertigo condition, that is spinning of your head and feeling dizziness and disbalance. And let us come to adolescent, because these conditions, what I have discussed, mostly it is found in male and female, and some research papers, the latest research papers, they indicate that in female, that is when their regular cycle is disturbed, or the menopause age, where there is drastic disbalance of estrogen hormone, steroidal hormone, means female sex hormone, that is called progesterone. So when there is disbalance of hormones, that is also one of the triggering factor in female, and 60 to 70% in females, this type of, that is a peripheral vertigo condition is there, and that is because of hormonal disturbance. And also the same symptoms are observed in adolescent school going children. In America, 5 to 10% adolescent children in the schools, they are suffering from a peripheral vertigo condition, means dizziness, and sometimes depressed, sometimes spontaneous spinning or twisting of the head. All these conditions are noticed, and that is because of that is called benign, that is proximate, that is benign, proximate, and positioning vertigo, that is called BPPV condition, is very common in school going adolescent children. And there, the most of the people in whole of the world, they are ignorant. They are not talking or thinking of such condition to adolescent children, how they are suffering that thing, because in school we don't know in what condition your children are put in classes, in laboratories, or in game, everywhere. Because sometimes brain injury, sometimes this ear injury, that also can cause this type of medical condition. Also, once stress or strain is there in school, where maybe your son, they are sleeping, they are misbehaving the teacher, which is very common in third world countries. That is also one of the contributing factors. That's why I am of this opinion that in every school where there are more than 500, 600 or 2000 school going children of adolescent age, means from the age group of 10 to 19, there should be some medical professional to take care of their health condition in the school, and to understand that these are all conditions which are not acceptable to behave or to treat the students. That is very, very important, because these are all latest research publications by American journals. That is, they have mentioned that adolescent vertigo and their factors and their causes. And mainly they have given multiple causes. How they are spending their time with their teacher, how teachers are torturing, how they are behaving, how bullying are going on, all are contributory factor. Stress, strain is also a factor. So we have to take care of all these factors for adolescent not to have. And sometimes parents are not aware that once they have dropped in the school, it's okay. They will not ask how you are spending your time with your teacher, with your colleague, with your friends, whether somebody is having any problem with you, any bullying, any stress, any strain, hitting, playing, getting any injury. Lot of all these things are to be taken care by health professional in the schools. And to my knowledge, even in many advanced countries, forget about Asia and Africa, that in every school, one health professional who is expert in physiotherapy as well as in all these medical condition of the children, who can understand the psychology and tension, stress, and all these things. Social medicine, it should be there. So that is what my observation. And let me show you one photo. And before that, let me tell you that in Nigeria, roughly 30 million people are suffering from this spinning or dizziness condition that is called vertigo, peripheral vertigo. And in India, there are 180 million. It's a big number, 20 to 30% population. Globally, it is more than 800 million people are suffering from this medical condition, vertigo, where their quality of life is compromised. They are depressed. They cannot go because they are not balanced. They are not confident to move. Always they are having the feeling of dizziness, feeling of spinning, feeling of that whole world around them, whole surrounding is spinning or moving. This is really very much critical condition, and we have to be careful. And I have given you all these conditions. Once you are going to doctor or physician, let him diagnose it properly, and mostly they prescribe antihistamine, muscle relaxant, painkiller drugs, and with that you can manage. This is very clear picture how a person who is having the vertigo condition is feeling. His sensation is spinning around his head. Lot of vibration type of spinning condition will be there, and he will be totally abnormal. He cannot balance in that such type of spinning or twisting condition around his head. You see, is a very clear photograph that if someone is having a vertigo condition, that the whole area she will feel cloudy, she will be imbalanced, and she will lose her balance, and she will sit down. And that is the condition where not only spinning up the head, but the whole surrounding, it will be her sensation and feeling that whole surrounding is spinning and moving, and she will lose the balance, and she will immediately sit or lie down. Very clear picture you can see here, where there is yellowish nerve cells. They are strong and stable, and in other side it is shown that where they are red and puncture type of nerve cells, that is the main cause in your internal ear. Such type of nerve cells are responsible of spontaneous spinning or disbalance of your head and body, and that one is going to trigger your nerve here also not properly. So if it is damaged, it will give the wrong signal to your brain stem cells, and that will make you the feeling of dizziness, the feeling of spinning, and the feeling of not balanced. You cannot move, and you cannot turn your head up and down or left and right very quickly, or reflex action will be seized. So this is very clear picture of your nerve, and it is actually the nerve cell damage or problem or compression in your internal ear. So here you have seen in the image and the photo of damaged nerve cells. It may happen in your internal ear, and that damage or that type of weak nerve cells are the main cause. It can happen due to some infection, ear infection also. There are a lot of typical names. Doctors, when you are going, they will tell you, and they are treating it with magnetic resonance imaging, and also with some magnetic radiation, some audiography. They will find out the type of infection or type of damage in the ear nerve cells and nerve hair, and also that is linked to your brain stem cells, and once it is damaged, the proper signal is not going, and that is causing the spinning. With this I will stop. Thank you very much for watching the lecture.